Dr. Bataille, awareness of skin cancer has increased over the last few years, as well as advice against it. Is there actually an increase in skin cancers because of sun exposure, or is it that we are actually looking and checking much more often for skin cancer?
I think there's a bit of both. We definitely see an increased incidence of skin cancer wherever you have a lot of dermatologists, so we cannot deny that fact. Mm-hmm. So like any cancer, screening is always attached to discovering more. So if you screen for early stage of cancer, you will discover them. And the issue is the same with prostate cancer and breast cancer, and melanoma is the same. However, there is still evidence that possibly exposure to the sun may have also affected these figures. And, you know, if you look over the last 50 or 60 years, the exposure to the sun is obviously increased dramatically with how affordable holiday abroad are. And the lag time between being at risk in your early childhood, early adulthood to getting the risk cancer is very long. So people always say to me, oh my God, I had a holiday, I had a sunburn last week, I'm going to get melanoma tomorrow. No, it is a cumulative sun exposure. It is a long lag period before between the exposure and the risk of cancer. But overall, most people will have had a few sunburn in their life, and it is quite important to reassure the population that, you know, having a few sunburn is not an extremely high risk because it's too common, and melanoma is not that common cancer in, you know, looking at all the other common cancer like breast, bowel and lung, melanoma is much less frequent.
Would you recommend going on a regular basis for screening for skin cancer?
We tend to recommend that we should have at least several risk factors. So either you're freckly, red hair or extremely light blonde hair, you have very poor ability to tan, you have multiple numbers of moles on the body, so we call them atypical nevi because they're slightly bigger than average. There is a cutoff we sometimes give to people as a guideline saying more than 100 moles on the body, but you know, people know when they look at their skin say I have a lot, and these patients should be screened. Most important factor is family history. If you have relative with melanoma, if you have relative with more than average numbers of cancers in the family, so we will always ask question about anybody with any type of cancer in your close relative, right. And this family was slightly more at risk, we would recommend the skin is screened. Yeah.
Mm-hmm. So and that you said any type of cancer, so if you are from a family with a history of cancer, you should get checked, particularly if you're fair and etc.
And lots
or
of
if
moles.
you abuse the sun.
Or if you abuse the sun, or, you know, most people would say, okay, if I've been brought up in California, Australia, South Africa, these people will be aware that they should have a checkup from time to time. Mm-hmm. Yeah.
Protection, sun protection.
Little bit controversial because I think in the UK maybe now we go a little bit too much the other way. Of course, we still have the very, you know, sort of dangerous behavior of going on holiday, not protecting ourselves and burning, so we don't want that, that's for sure. But the other side of the coin is that because we've been so good at warning against the negative effect of the sun, now people use SPF in their day cream, especially women, of course. In their day cream they have an SPF. Foundation, there are SPF in most foundation in the UK now. So what we see actually is a problem of deficiency in vitamin D, because our exposure to the UVs dropped dramatically. So as a vitamin D is crucial. And if as a dermatologist you advise really sun avoidance, but the other side you make your population unhealthy because their vitamin D is too low, it's not a good goal. So I think we have to be a little bit of common sense and make sure that in the winter, in the autumn, we don't wear sunscreen in the UK.
Yeah.
In a daily basis. I didn't mean if you go for a long picnic for 5 hours in the park, or you know, if you have long exposure you might protect yourself, but for daily exposure people should not have sunscreen on their face on every day.
So a question of common sense and balance overall.
And also realizing what type of skin you have, because I sometimes have people who have, you know, dark eyes, very dark hair, tan extremely well, and they say to me, oh, I'm using SPF all the time and I'm always with my factor 50, I'm terribly worried. And I say to them, no, your melanin is extremely dark, you're protected against skin cancer, and a patient like you can relax. Of course, my advice to somebody with blonde hair or red hair will be completely different, but sometimes there is a tendency in public health campaign to just throw the message across, but it doesn't apply to everybody because everybody has different skin.
All right. Thank you very much,
Thank
Dr.
you.
Bataille.